An autoimmune disease is a systemic problem, which means you have to treat it at the level of your entire digestive system. No other approach, not steroids, not anything else, antispasmodics or anything else your doctor may give you, none of those things are going to make you well again. Even if they provide some short-term symptom relief, you're digging the hole deeper. So hi there everyone, Christian here, back again. I got a couple of different emails, one from a student asking if I could talk about leaky gut. And what I want to say about leaky gut first is I do talk about leaky gut. If you don't know what leaky gut syndrome is, if you have a hardcore digestive illness, you need to know how your body can get so out of balance that it ends up attacking itself. That's what an autoimmune condition is. So when we're talking about leaky gut syndrome, you're talking about a situation where the bacteria that's supposed to be contained in your intestinal tract is actually getting getting through the intestinal lining into your bloodstream. And this causes absolute havoc inside your body for obvious reasons, which is your body thinks you have a systemic infection, which in fact you do. And so I talk about this at great length. So my point about this, before I say more, is the pivot protocol I've covered, there's not a scenario I can think of regarding digestive illness that is not covered in there. So if you're asking a question about something like leaky gut or autoimmunity, I promise you I talked about it and covered it with real clarity and thoroughness, from understanding exactly what's happening to your body to then what are you supposed to do about it. Interestingly, the solutions in all of this tend to be the easy part, but it is important that you understand what is happening to your body so that you need a good mental picture. You need a clear understanding. Part of putting your mind at ease, part of your recovery process in some sense, is understanding what is happening to you. You want to understand what's happening to you. And the worst news that you need to face, the more you need to face it, right? So that we can plan out and strategize, and so that I can give you the tips and tactics for actually fixing your gut, right? Not just temporarily, but for the long term. Okay, this is very important. Another student asked about, it wasn't a student actually, somebody came across my material, I guess, and sent me an email and said, oh, your program won't work for me, I don't have a gallbladder. It's like, but I have a whole video on what you do about that, right? People who have had gallbladder surgery, had their gallbladder removed, have gallbladder disease, infections in the gallbladder, you need to know about that, right? And I did cover it, and it's in there. It's in a special video in the phase 1 material, so that you're not in the dark. Hey, if I'm missing my spleen or if I'm missing my gallbladder, what do I do about this kind of situation? Is there hope for me, right? Is ultimately what people are asking. I have mad digestive symptoms, but I'm missing my gallbladder. What do I do about this? Like, well, here's what you need to know, okay? And no serious medical professional is going to tell you, oh, I predict that, you know, you can heal yourself in a week or whatever. I don't know you. When I'm getting emails from people, I don't have any ability to diagnose you in clinic. I'm offering information that you can then take and use to fix your own body. You know your body best. You know what's happening. You live with you 24/7, 365, all life long. And so if you understand the signals that your body's giving you, that's a huge, huge leg up. And so if you're in a special situation, like you've had your gallbladder removed, well, I talk about that. I give you real clarity about what could be going on, what to expect. You can target based on what I'm telling you. Okay, that's my situation. What he said just then is what applies to me. Obviously, there's not going to be one scenario that's going to play out for somebody who's missing a gallbladder. If you had 10 patients who had their gallbladder removed, all 10 of them may have different patterns of symptoms, right? And so we need to understand and be able to track that down and use the logic of the pivot protocol system to try to make sense of where you go from here, because that's ultimately the question that people are trying to ask and get an answer for. So I am offering you and providing you with the kinds of even outrageous scenarios that for a lot of you this is what's happening to you, right? Autoimmune disease is not common, but when it happens, where do you turn? I mean, there's not that much good information for patients to fix their own autoimmune condition. And the ancient method that I discovered and that I teach you about in the pivot protocol, it goes way beyond any kind of fad diet advice. We're specifically looking at your exact symptoms, the mechanisms causing those symptoms, and then trying to treat the underlying organ imbalance using very simple food combinations, diet, the tips and advice, but principles, right, based on a totally different logic than anything you're likely to have ever heard before. In fact, I'll say it, if you've heard this before, you would already have been, you would have healed yourself already. So if you're sick and you don't know where to turn and you don't know where to get any kind of advice at all that may actually result in a good outcome for you, I promise you haven't seen what I have for you in the Pivot Protocol. But, and what I want to say is, make sure you go through the materials multiple times. I know it's a lot. For some people, this is very, very difficult. But if you can't do 15 to 30 minutes of actual just study, where you watch a video, take some notes, write some things down, figure out what you need to do next. If you can't do that, I can't help you. If you can't make the time to actually help yourself improve your health by going through a little bit of material or reading some of the print material or watching a lecture and trying to think about it a little bit and how it relates to your condition, there's nothing difficult in here. The whole program is done at about a 7th grade level. But you have to do the work of going through and actually figuring out, okay, if I have a leaky gut syndrome situation, here's where he's talking about that. How is that relevant to me? Sending emails to me and saying, hey, could you do something on leaky gut, means that you didn't go through it. It means that you didn't cover the material carefully enough or go back through it a second, even a third, fourth, and fifth time. It's worth it, because once you master this material, you really do have the keys to keeping yourself healthy from the point of view of digestive health for the rest of your life. You'll never not know what to do the moment symptoms creep up. You're always then course correcting very quickly. So instead of going way out of balance where you end up with autoimmune disease, you bring yourself back into balance very quickly. And down the road, you're never going out of balance far. You're actually bringing yourself back into a kind of good, healthy organ function, and your body comes back into alignment very quickly, where everything is working together again. This is the goal of this program that I've done. So make sure that you go through the material. And again, with leaky gut syndrome, the main thing is the same mechanism that's causing acid reflux, food stagnating in the intestines, will result in leaky gut if you have enough food and waste that build up in your intestines. And I give you reasons why the body will hold on to, right? A lot of food and waste will build up in the intestines. It's not a simplistic kind of answer. That people go, well, if there's waste, then I should take a laxative. It's like, no, you should not take laxatives. There's almost no scenario where it's good to take a laxative. Certainly not if you have a chronic problem with food stagnating in your intestine. It's the exact opposite thing that you want to do. So you don't want to apply simplistic solutions like taking laxatives to get rid of food stagnation, because you need to understand the mechanism that gives rise to a lot of food stagnating in your intestines is more complex than just, okay, let's flush everything out. The moment you do that, you create worse problems, usually with very serious dry symptoms. If you know anybody who's taken laxatives for multiple years, it's a nightmare. And it's one of the worst outcomes you can have, to do something like that to yourself because you didn't know better. And I do hear from students and patients who have been in that exact situation. And so that's a dreadful thing to do to your body. Most people just don't know better. So understand, struggle a little, and work and listen to what I'm saying about the mechanism. How does the liver affect food stagnation? What happens to your spleen that it's producing all of the conditions that causes food to get stuck and waste to get stuck in the pockets that build up in your intestines? If you understand this and you have a clear mental picture of it, then when we apply the solutions, which again are pretty much the easy part, getting that back in balance and keeping it that way is actually the simple thing that we have to do. That comes at the end. But it's important that you understand these mechanisms, because the deeper you have a clear mental picture and a clear understanding of the logic of how your organs actually work, the less likely you are to cause yourself problems, and the faster you will heal, because I'm setting you up to automatically apply the kinds of solutions that you get in the program, but that you can select them quickly. Like, you know exactly which tool in the toolbox you need to reach for, because you understand the mechanism giving rise to your symptoms. That's the longer term part of the training that you need a little bit of time to work on and to understand. Usually people need to hear this repeated 3, 5, 6, 10 times, right, before you really get what's going on inside you. But it is worth it. It is worth it to figure that out. So when food and waste stagnate, right, bacteria can then build up. It is multiplying all the time. If you leave enough fuel in there, these bacteria will multiply like crazy, and then it leaks through. And what you get is this damage to the intestinal lining. The intestinal lining is designed when you're young and when it's healthy and it's not damaged, you have these hair-like structures, villi, and the bacteria and food particles, large food particles, will stay at the outer portion of this. So this layer protects bacteria from getting down to the base layer where it then passes through the membrane into your bloodstream. You don't want big food particles with lots of bacteria on them getting into your bloodstream. That's bad, and that the outer delicate layer of your intestines will protect you from that. Now, if you have an inflammatory bowel condition, if you've damaged this lining, if you have irritable bowel, right, all of those things indicate that damage has been caused to some portion of your intestinal lining. And once that happens, you're wide open. You're very prone to bacteria getting into the body, and for all kinds of really hellish autoimmune kind of symptoms to crop up. Okay? And the way that you fix that is to get the waste out of there. You start to have good, proper, healthy digestion, where digestion is two things. It's absorption of the right nutrients, right, the good things, which implies that you're eating good nutrients, and also elimination of waste. We need both of those aspects to work and work properly. And so to beat leaky gut, we got to get that mechanism working again, which is to say you got to get your pivot working again, which is what I'm teaching you in this program. But the whole thing has to work. You can't put your finger in the dike, so to speak, and try to fix leaky gut autoimmune disease. An autoimmune disease is a systemic problem, which means you have to treat it at the level of your entire digestive system. No other approach, not steroids, not anything else, antispasmodics or anything else your doctor may give you, none of those things are going to make you well again. Even if they provide some short-term symptom relief, you're digging the hole deeper. So you need to get your organs working together. Once you have a systemic problem like that, you need a systemic solution. And as far as I know, there is no other systemic solution like the pivot protocol. I've certainly never seen one. That's why I created it. I wish that I had this when I was sick, that somebody had done this for me. And so that's what I want to say about leaky gut. If you haven't gotten started on the pivot protocol, no time like the present. And if you do have other questions on stuff, make sure that you're going through the material often enough. Make sure that you've done your own diligence to try to find answers to stuff in there before you're sending me questions like this. Not because I mind answering them, but more because it indicates that you're not serious about healing if you're asking questions about stuff that I've definitely put in there and that I talk about in multiple places, right? Most of what you need to know, with almost no exception, is going to be found in the pivot protocol. It's up to you to study it and then apply it. And then if you have questions or confusion, or the outcome didn't come out the way you wanted, right, obviously then you can send me a question. Better yet, just join coaching. I've put together a coaching group. The results are fabulous. I put out some testimonials for people who have been through coaching, and usually within a couple of calls, a couple of weeks, right, you know what you're doing well enough, you know what I know, so you know what to apply, and you know how to fix yourself, and you don't need me anymore, which is great and fine with me, and you're out of group coaching, but you really master the pivot protocol quickly. It's the single best thing I can do for you, is to recommend, just learn from me directly. We get on a call once a week, we talk about what's happening, you send me some information ahead of time so I know exactly what's going on with you, and then we get you well, right? And week by week we're making small changes, getting details right, and eventually you come out knowing exactly what you need to do in order to sort your digestion out. Okay, that's all from me, and thanks again. Click below to join the pivot protocol.